My name is Svetlana Leontьeva. I am the chief of party of the PATH-led USAID Serving Life project. And today I would like to present a peer-driven community outreach model to extend reach to HIV testing services to networks of people who inject drugs implemented within USAID Serving Life project. I have no conflict of interest to report. Reaching people who inject drugs within HIV testing services in Ukraine is important, because HIV prevalence among PVID is 20.3%, according to the 2020 IBBS data, up to 4 times higher than other key population groups. This high prevalence reinforces the need for focused HIV care testing and linkage strategies that tap into PVID networks. Serving Life project introduced and scaled up a peer-driven community outreach model leveraging social network testing and index case testing principles to reach PVID and their partners using peer case finders in 12 regions of Ukraine. Serving Life leveraged principles from social network-based testing and index testing to develop and introduce an innovative model to improve reach of HIV testing services among PVID communities through peer case finders. Project-supported NGOs recruited peer case finders from among former or soon-to-be-released prisoners, whose imprisonment term was less than 3 years and with previous injecting drug use history. These case finders were employed by project NGOs and trained to conduct outreach and index testing services to mobilize peers and contacts from their social, sexual, and drug-injecting networks for HIV testing services. Unique features of Serving Life's S&T approach are as follows. First, to maximize reach among hidden PVID networks, Serving Life partner NGOs prioritized hiring in underserved geographies and frequently rotated peer case finders to source new networks. Second, Serving Life prioritized placement of peer case finders in communities with large number of PVID, but low HIV testing coverage. Third, the involvement of peer case finders who and their contacts of PVID enhanced the acceptability of the outreach and testing services provided by these peer case finders. Peer case finders and social workers provided HIV counseling, offered HIV self-testing services among PVID communities, and that was the first wave, followed up with the recruited peers to confirm HIV self-testing results and provided escorted referrals and to ensure linkage to prevention services, such as harm reduction, syringe and needle exchange programs, as well as the treatment services at the healthcare facilities. Peer case finders also offered ICT index case testing services to partners and biological children of HIV-positive PVID identified through S&T, community outreach, and that was the second wave of testing, aligning with principles for safe and ethical ICT. Peer case finders counsel HIV-positive PVID, current and new on ICT. If an index client accepts ICT services, the peer case finder or social worker requests a list of partners and biological children and reaches out to elicited contacts to offer HIV testing services, with an option provided for assisted or unassisted HIV self-testing. The NGO social worker or peer case finder delivers an HIV self-testing kit to index partners either at home or at a public location. With contact's consent, the peer case finder provides assisted HIV self-testing and supports the contacts to interpret their results. Contacts opting for a non-assisted HIV self-testing have an option to contact an NGO social worker back to have a post-test counseling session. Individuals with reactive results are provided with accompanied referrals to healthcare facilities for confirmatory diagnosis and treatment initiation. Clients with HIV negative test results are referred to prevention services, such as medication-assisted therapy, needle syringe programs, counseling on PrEP. We analyzed 18 months of program data to understand the model's success in reaching HIV-positive PVD and their contacts. This figure shows results from the first wave of testing using S&T principles. From October 2020 to March 2022, 10,696 PVD were tested for HIV, among whom 156 were diagnosed HIV positive. That's reflecting a testing positivity rate of 1.5%. The figure on this slide shows results from the second wave of testing, where ICT was offered to HIV-positive PVD. Among 2,798 PVD tested for HIV from October 2020 to March 2022, 277 were confirmed HIV positive. That stands for 10% testing positivity rate. Actually, I would like also to highlight while more PVD were reached and tested through S&T during the first wave, HIV testing through the second wave was more efficient, with the testing positivity rate that is 6 times higher than the rate observed during the first wave. This slide shows the entire ICT cascade of services for the same time period, 18 months. Use of trusted workers led to high acceptance of ICT among HIV-positive PVD, with an almost equally high percentage of elicited contacts who accepted ICT services. Linkage to treatment was high, within 95% of newly diagnosed people living with HIV initiated on IRT. This slide compares the linkage to IRT between S&T and ICT waves by quarter. As you see, when we launched this intervention in October-December 2020, linkage to care was relatively low, at 78% and 64% for S&T and ICT respectively. By January-March 2022, linkage to care across both models was 100%. When the Russian-Ukrainian war started, Serving Life was able to maintain essential health services to PVD networks. The project continued HIV case finding and linkage to care among PVD. During the war, the partner NGOs held online phone counseling session on early treatment initiation, treatment adherence, retention in care for PVD newly diagnosed with HIV. Also, food packages and hygiene kits were provided to PVD with HIV on IRT to help them retain on IRT. Our results highlight the promise of using a peer-driven S&T and ICT-based outreach models to efficiently tap into networks of HIV-positive PVD and their contacts and link them to HIV services, and further expansion of this approach to reach PVD and their partners' contacts with HIV services is essential to achieving epidemic control in Ukraine. On behalf of PES, I would like to cordially thank USAID and PEPFAR for funding our Serving Life project and our 13 national and regional partner NGOs who implemented these innovative HIV testing models in Ukraine. Thank you very much for your attention.